Lomefloxacin is a fluoroquinolone used to prevent and treat a wide variety of infections in the body. In this video, let's found. What is lomefloxacin? What is lomefloxacin used for? Contraindication. What are the side effects of taking lomefloxacin? How does lomefloxacin work? How to use lomefloxacin? What is lomefloxacin? Lomefloxacin hydrochloride is a fluoroquinolone antibiotic used to treat bacterial infections including bronchitis and urinary tract infections. It is also used to prevent urinary tract infections prior to surgery. Lomefloxacin is associated with phototoxicity, central nervous system adverse effects. In October 2008, the FDA added the following black box warning to the product insert for Maxaquin. Lomefloxacin is unique in that it forms a magnesium chelate with itself. The chelate is formed between the 2-carbonyl group of two separate lomefloxacin molecules. It was patented in 1983 and approved for medical use in 1989. What is lomefloxacin used for? For the treatment of bacterial infections of the respiratory tract, chronic bronchitis, and urinary tract, and as a preoperative prophylactic to prevent urinary tract infection caused by S. pneumoniae, H. influenza, S. aureus, P. aeruginosa, E. cloacae, P. mirabilis, C. subversus, S. aspergillosis, E. coli, and K. pneumoniae. Contraindication. Lomefloxacin should be avoided in patients with known prolongation of the QT interval, patients with uncorrected hypokalemia, and patients receiving Class IA, quinidine, procainamide, or Class III, amiodarone, sotalol, antiarrhythmic agents. Side effects. Common side effects of Maxaquin, lomefloxacin hydrochloride, include nausea, vomiting, diarrhea, headache, lightheadedness, drowsiness, ringing in the ears, increased sensitivity of the skin to sunlight. Pharmacodynamic. Lomefloxacin is a fluoroquinolone antibiotic used to treat chronic bronchitis, as well as complicated and uncomplicated urinary tract infections. It is also used as a prophylactic or preventative treatment to prevent urinary tract infections in patients undergoing transrectal or transurgical procedures. Fluoroquinolones, such as lomefloxacin, possess excellent activity against gram-negative aerobic bacteria, such as E. coli and Neisseria gonorrhea, as well as gram-positive bacteria, including S. pneumoniae and Staphylococcus aureus. They also possess effective activity against Shigella, Cella, Campylobacter, gonococcal organisms, and multi-drug-resistant Pseudomonas and Enterobacter. Mechanism of action. Lomefloxacin is a bactericidal fluoroquinolone agent with activity against a wide range of gram-negative and gram-positive organisms. The bactericidal action of lomefloxacin results from interference with the activity of the bacterial enzymes DNA gyrase and topoisomerase 4, which are needed for the transcription and replication of bacterial DNA. DNA gyrase appears to be the primary quinolone target for gram-negative bacteria. Topoisomerase 4 appears to be the preferential target in gram-positive organisms. Interference with these two topoisomerases results in strand breakage of the bacterial chromosome, supercoiling, and resealing. As a result, DNA replication and transcription is inhibited. Half-life: 8 hours. Dose: ophthalmic, bacterial conjunctivitis. Adult, instill 0.3% solution into the affected eye/S oral. Acute bacterial exacerbation of chronic bronchitis. Adult, 400 mg once daily for 10 days. Oral. Prophylaxis of surgical infections. Adult, 400 mg as a single dose 1 to 6 hours before procedure. Oral. Complicated urinary tract infections. Adult, due to E. coli, K. pneumoniae, P. mirabilis or aeruginosa, 400 mg once daily for 14 successive days. Oral. Uncomplicated urinary tract infections. Adult, 400 mg once daily. Due to E. coli, for 3 successive days. due to K. pneumoniae, grabilis or S. saprophyticus, for 10 successive days. Otic/oral. Otitis externa, otitis media. Adult, instill 0.3% solution into the affected ear/s. Safety advice. Lomefloxacin has been assigned to pregnancy category C by the FDA. Some animal studies failed to reveal evidence of fetal harm, however, studies using high doses demonstrated fetotoxicity and teratogenicity. That's all the information about Lomefloxacin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.